It is indeed a great honor to be entrusted with this responsibility, and I should like to assure you that I will do my utmost to guide the deliberations of this committee in a productive and efficient manner, given the workload in front of us. The World Health Assembly's theme this year, All for Health, Health for All, is much aligned with the core values and the ethos of India. That is Vasudhaiva Kutumbakam, which means the world is one family. During COVID-19 pandemic, India has not only managed the crisis within the country, but also supplied vaccines and health-related products across the world, embodying the spirit of one world, one family. This philosophy guides our efforts to promote well-being for all, facilitate universal healthcare coverage, and achieve health-related sustainable development goals. I am of the view that the traditional public health approach of focusing on community interventions such as information and awareness, as well as preventive measures, hold the key to better health outcomes. India has established more than 173,000 health and wellness centers to not only address health issues at the community level, but also focus on educating communities towards better health-seeking behavior. At this critical juncture, when all countries are working towards our collective sustainable development goals and ensuring health services for all so that no one gets left behind, India has been taking the lead in advocating for digital health innovations as key to the crucial transformative process required to help us achieve our goals. I would like to extend a very warm welcome to all the delegates of WHO member states and the representatives of the United Nations and its specialized agencies, as well as to the observers and non-state actors. May I also, on behalf of the delegates, welcome the representatives of the Executive Board who will participate in the deliberations of the committee in accordance with the rules 43 and 44 of the Rules of Procedure. I should like to stress that the Executive Board representatives speak as members of the board appointed to represent the board's views and thus do not speak as delegates expressing the views of their governments. Before I announce some of the details of our proposed method of work, I would like to complete the first item of today's agenda, election of vice chairs and rapporteur. I have been informed of the following proposals. Mrs. Katarzyna Drezek-Laskowska from Poland and Mr. Alexandre Pena Ghisleni from Brazil as vice chairs of Committee A, and Mr. Lombo Emma Tiaho from Burkina Faso as rapporteur. Are there any comments on the proposal of Mrs. Katarzyna Drezek-Laskowska as vice chair of Committee A? As there are no comments, may I ask you to elect Mrs. Katarzyna Drezek-Laskowska as vice chair of Committee A by acclamation. Next, are there any comments on the proposal of Mr. Alexander Pena Ghisleni as Vice Chair of Committee A? As there are no comments, may I therefore request you to elect Mr. Alexandre Pena Ghisleni as Vice Chair of Committee A by acclamation. Finally, are there any comments on the proposal of Mr. Lombo Emma Tiaho as rapporteur of Committee A? As there are no comments, may I ask you to elect Mr. Lombo Emma Tiaho as rapporteur of Committee A by acclamation. I now request Mrs. Drezek-Laskowska, Mr. Pena Ghisleni, and Mr. Tiaho to please come to the rostrum to take their seats.